Hi guys, welcome to Agni Nursing Academy. I am Prakash Kulki. Today, this is our third session of MCQ series. Today I came with the practical based and skill based questions. Okay, let us start with the first question. That is, a nurse is collecting the blood sample for the patient CBC test. She applied the tourniquet and palpated the antecubital fossa. After finding suitable vein, she cleaned the site with spirit and immediately insert the needle. What is the nurse's mistake in this procedure? And option A, she did not select the correct vein. She did not allow spirit to dry before vein puncture. She used wrong site for collection. She applied the tourniquet too tightly. So in this question, they have given one scenario. In that, they are asking mistake of the procedure, mistake of the nurse. Then let us discuss one by one points. A nurse collecting a blood sample for patient for the CBC test. Now she is collecting the sample for CBC. For CBC we will use the EDTA vial. EDTA container. That EDTA container containing the agent EDTA, that color is lavender. The color code for the EDTA tube is lavender. Okay, then coming to the next point, she applies the tourniquet and palpate the antecubital fossa. See, she is tying the tourniquet. Tourniquet is used for to make the veins visible. To make veins visible and palpable. This point also correct. Okay, tourniquet and palpate the antecubital fossa. This is also correct point. And after that, finding the suitable vein, she cleans the site with the spirit. Yes, we have to clean the site with the spirit or alcohol based solutions. And after that, wait, here she used the spirit or alcohol, that is 70% concentration. And after that, immediately insert the needle. See, whenever you applied the spirit to the site, we have to wait to dry completely. We have to wait for to dry completely, because alcohol can cause the hemolysis. Okay, hemolysis, and can irritate the patient. Okay, can cause the irritation to the patient, like burning sensation. And one more point, it can cause the contamination of the sample or contaminate with the sample. Okay, so after applying the spirit and alcohol, we have to wait for complete drying of the solution. After that, we have to insert the needle into the vein. So here nurse she did, immediately insert the needle. She didn't let the solution dry, so that can cause the patient irritation and hemolysis and contamination of the sample. So coming to the option A, she did not select the correct vein. So for the vein puncture, we have to select the correct vein. For the sample, we have to use medial cubital vein. This is the first priority for the vein puncture. Okay, medial cubital vein. Otherwise, we have to use the cephalic vein or basilic vein. This is second, this is third. Okay, so she selected the correct vein for the blood sample. This is also the correct point. And coming to the option B, she did not allow the spirit to dry before venipuncture. Yes, this is the mistake of nurse by taking the sample. She didn't allow the spirit to dry completely. This is the correct answer of this question. And coming to the option C, she used the wrong site for the collection. No, she used the correct site for the sample collection. She applied the tourniquet too tightly. No, in the scenario they didn't given the particular tight word. Okay, correct answer of this question is B. Then let us move on to the next question. In male patient, what is the correct direction of the cleaning the penis before catheter insertion? See this, in this question they asked the correct way to clean the site for the catheter insertion. First of all, you have to know about catheterization. Catheterization, it is the sterile procedure. Sterile procedure, we have to maintain the sterile technique. You have to maintain the sterile technique. So how to clean the site? For male patient, we have to clean the site from urethral meatus. We have to clean the urethral meatus outward in circular motion. See, we have to clean like from urethral meatus to in circular motion. We have to clean like this. This is the correct way to clean the area of the site of urinary catheterization. Now coming for the female patient, we have in the female slight difference in the cleaning of site. First we have to separate the labia majora and labia minora with the non-dominant hand. We have to separate labia majora and labia minora, and after that we have to clean the one side labia minora with the sterile gauze from front to back, and again we have to clean the another labia minora, same front to back. And you should know, for one stroke you have to one gauze. Okay, one gauze for labia minora front to back, and one for another labia minora front to back, and another for at the site of urethral meatus. You have to use one for urethral meatus. After that we have to clean the surrounding downwards and up to anus. Don't clean from back to front, it can cause the contamination. So this is the correct way to clean the female, and in male urethral meatus outward in circular motion. Then coming to the options, from base of the penis towards the meatus, no, it can cause the contamination. Option B, from meatus outward in circular motion. Yes, this is the correct answer of this question, from meatus outward in circular motion. Then coming to the option C, from scrotum upward, no, this is can cause the contamination, and random cleaning all over. So this is totally wrong. We have to follow the sterile technique. We are not supposed to clean randomly. Okay, this is the correct answer of this question. Option B is the correct. Let us move on to the next question. What is the next question? A nurse collects the blood for culture before starting the antibiotics. She disinfects the site with iodine, then wipes with the alcohol before puncturing the vein. What was this the correct method? Again they have given the scenario and they are asking the mistake of the nurse. Coming to the option A, yes, it prevents the contamination. No, alcohol should not be used after iodine. And yes, if gloves are sterile, no, iodine should be final antiseptic layer. Now I will tell some important steps and major steps to follow how to collect the blood sample for culture. First one, we have to arrange all the things. Arrange all the things which all are used for culture. After that, we have to tie the tourniquet. We have to tie the tourniquet. After that, we have to wear the gloves. After wearing the gloves, we have to clean the site with, this is the important, clean the site with betadine or chlorhexidine solution. chlorhexidine solution. No need to use the alcohol. Okay, if you want to use the alcohol, use before the applying the betadine, so this can more effective to take the culture. After that we have to wait to dry completely. After that we have to insert the needle. First we have to tie the tourniquet, after that we have to wear the gloves, and after that we have to clean the site with the betadine or chlorhexidine solution, and after that wait to dry completely. After that we have to insert the needle. Then here coming to the option, so I will discuss the question first. She disinfect the site with iodine. Yes, she clean the site with iodine, and after that then swipe with the alcohol. She used the alcohol after the applying the iodine. This can cause, so alcohol can affect the effectiveness of iodine, so this can lead to contaminate. So we have to use betadine. After that we are not supposed to use the alcohol based solutions. So coming to the options, yes, it prevents the contamination. No, it can cause a contamination. Option B, no, alcohol should not be used after iodine. Yes, this is the correct answer of this question. No, alcohol should not be used after iodine. Then coming to the option C, yes, if gloves are sterile. So there is no connection between the gloves and alcohol. So this is also the wrong. No, iodine should be the final antiseptic layer. In place of iodine we can use the chlorhexidine solution also. So this is also the wrong. The correct answer of this question is B. Then coming to the next question, a depth of chest compression in adult during the CPR should be. This is the basic life support. Okay, we have to do proper and correct. So I will discuss here the quality of good compression. What are the good qualities of chest compression? First one, we have to push fast and hard. How much fast we have to push? Fast means how much chest compression per minute. That is in adult, children and infant, we have to do chest compression 100 to 120 per minute. 100 to 120 per minute we have to do chest compressions. And hard, how much depth we have to push the chest in adult and children. In adult and children we have to push the chest compression up to 2 inches or up to 5 centimeter. In coming to the infant, in the infant we have to push the in the depth of 1.5 inches, that is 4 centimeter. In the adult and children 2 inches, and in infant we have to push up to 1.5 inches. And next one, that is make less interruption. While doing the CPR we have to make no interruption in between the changing the position, and we have to give the chest compression, we have to give the ventilation to the patient. In between there is no long gap between the chest compression and ventilation. Okay, then coming to the third point, allow the chest complete recoil. While doing the chest compression we have to let the chest to complete recoil. This is for make effective cardiac output. For blood proper blood circulation we have to allow the chest completely recoil. These are the qualities of chest compression. Then coming to the option, in the question they asked adult, so I already told 2 inches for adult and children and 1.5 for the infant. Option A is wrong. Option B 1.5 in the infant we can use, and option C 2 inches. Yes, this is the correct answer of this question. 2 inches is the correct answer for this question. More than 3 here they have given. This can cause the injury to the victim. Answer of this question is C. Then coming to the next question, the minimum time recommended for rubbing hand with the alcohol based hand rub. So this is on the hand hygiene. The question is on hand hygiene. In this question they asked a recommended time for the hand rub. Here I will discuss for all hand rub, medical hand washing and surgical hand washing. For alcohol based hand rub and medical hand washing or soap and water washing, and coming to surgical hand washing, that is or scrubbing. For alcohol based hand rub we have to rub the hands up to 20 to 30 seconds. In medical hand washing we have to do hand wash up to 40 to 60 seconds. And for surgical hand wash or scrubbing we have to do 3 to 5 minutes and ideal 5 minutes. For hand rub we have to do 20 to 30 seconds, and for hand washing we have to do 40 to 60 seconds. For scrubbing 3 to 5 minutes. Then coming to the options, option A 5 seconds, this is wrong. Option B 10 seconds, no. Option C 20 seconds, this is also the wrong. And option D is the correct answer of this question. We have to do hand rub for 20 to 30 seconds for the effectiveness of the solution or effective hand hygiene. Then move on to the next question. Again it is on CPR. If the child requires CPR and 2 rescuers are present, what is the correct compression to ventilation ratio? So they asked compression and ventilation ratio. What is the compression and ventilation ratio? Then coming to the compression, how much compressions we have to give per minute? For adult, in children and infant we have to give 100 to 120 chest compression per minute. You have to give 100 to 120 for all adult, children and infant also. And coming to the ventilation, how much we have to give ventilation? For adult, every 5 to 6 seconds you have to give one ventilation. Ventilation means breathing. You have to give the breath mouth to mouth or mouth to nose. This is for adult. Okay, for adult we have to give mouth to nose, or if we have the oxygen device means we can use the ambu bag also. For children or infant, this mouth to mouth and mouth to nose we have to use for the adult and children's also. For infant we have to do mouth to mouth and mouth to mouth and nose also. Okay, we can cover the infant's mouth and nose at a time. Okay, because infant face will be small, we can cover the mouth and nose also. So ventilation we have to give mouth to mouth or mouth to nose or ambu bag, whatever we have the oxygen devices. Then methods of chest compressions. How to give the chest compression for adult? For adult we have to use the both the hands by locking the hands. Two hand method. Okay, two hand method. For children we have to use the one hand method. We have to push the children chest. Okay, then coming to the infant, there are two types in the infant. Two thumb method and a two finger method. Two finger method. See, in the infant we have to use the two thumbs, and using the two thumbs we have to push like this, and for in that two finger method we have to use this index finger and middle finger. We have to push the chest of the infant like this. Okay, this is the correct way to give the chest compression. Okay, for adult two hand method, for children one hand method, for infant and neonate we can use the two thumb or two finger method. Then coming to the ratio, what is the correct ratio for the chest compression? If the adult is the victim, we have the two rescuer, we have to give the 30 compression and 2 ventilation. Okay, 30:2. If the rescuer 1 also, we have to give the 30:2. In coming to the children or infant, here there is a difference between the adult and children. If we have two rescuers, we have to give 15:2, and if we have the rescuer 1 means we have to give the 30:2. Now coming to the question, they are asking for children. They are asking for the children. According to here they are given the two rescuers. For children they are given the two rescuers. We have to give the 15:2. Correct answer of this question is 15:2. If the rescuer given here 1 means, here if they given 1 rescuer means we have to give the 30:2. So answer of this question is B. Then these are the important compressions. 100 to 120 ventilation, we have to give the mouth to mouth, mouth to nose or oxygen device we can use, and method two hand method, one hand method for the children, and two thumbs and two finger method for the infant. Then let us move on to the next question, that is according to the WHO, hand hygiene should be performed at how many moments of patient care? Here this is on the hand hygiene. Okay, in this question they asked how many movements in the hand hygiene. Let us discuss the movements of hand hygiene. Movements of hand hygiene, there are total 5 movements are there. That is, we have to do in the proper way. There are 2 first, 2 before, 3 after. What is this 2 before 3 after means? 2 movements we have to do before touching the patient. And second one, before doing the any procedure, that is a clean procedure or sterile procedure, before doing the procedure. Then coming to the 3 after, that is 3 after means after touching the patient. After touching the patient we have to do hand hygiene. After exposure to the body fluids of the patient, that is secretion, blood, sweat. Okay, exposure to body fluid. Then fifth one, after touching patient surrounding also. After touching the patient being surrounded, that is also considered as a contamination. So these are the 5 movements of hand hygiene: 2 before and 3 after. Touching the patient, before touching the patient, before doing the any procedure, after touching the patient, exposure to the body fluid, and after touching the patient surrounding. Then coming to the options, in the discussion I already told there are 5 movements in the hand hygiene. We have to follow the correct sequence: before touching the patient, before doing the procedure, after touching the patient, after exposure to body fluid, and after touching the surrounding. Okay, and which all are the solutions? If you solutions for hand hygiene, what all are the solutions for hand hygiene? We have to use the alcohol, that is isopropyl alcohol. That concentration should be 60 to 80%. That ideal is 70%. And we can use the chlorhexidine. chlorhexidine solution. Nowadays in clinical practice, chlorhexidine used for the hand hygiene, most commonly nowadays using this solution. Then next one, betadine. Here this betadine we will use in the high sterility maintaining procedures. Sterile procedure we have to use this betadine. So this is our today's session. These are more practical and skill based questions. Okay, I will come with the next important questions and suggest me the important topics which I can discuss with you, and download the Agni Nursing Academy from the Play Store, and you will get the more information, and we have a test series for you in the reasonable price. You can attend the test and you can grow your skills. Okay, thank you. Bye bye.